Imagine having a stealthy passenger in your body, quietly present but not causing any trouble. You might not even know it is there. Now, imagine that passenger suddenly waking up and starting to cause problems. Could something so dormant truly become active? Yes, latent tuberculosis infection can absolutely become active tuberculosis disease. This is a crucial point to understand about tuberculosis, and it is why medical professionals often take latent infection very seriously. While the bacteria might remain dormant for many years, there is always a potential risk that it could reactivate. When you have latent TB, it means that the Mycobacterium tuberculosis bacteria are present in your body, but your immune system has successfully contained them. Think of it like your body building a protective wall around these tiny invaders. This wall prevents the bacteria from multiplying rapidly and causing the typical symptoms of active tuberculosis disease. However, if your immune system becomes compromised or weakened for any reason, that protective wall can start to break down. This allows the dormant bacteria to multiply, leading to full-blown active TB. Common factors that can weaken your immune system include serious health conditions like HIV infection or poorly controlled diabetes. Other risk factors are certain medications that suppress the immune system, such as those used for autoimmune diseases or organ transplants, chronic kidney disease, or even severe malnutrition. These circumstances significantly increase the risk of the contained bacteria breaking free and causing disease. This transition from a controlled, inactive state to an uncontrolled, multiplying state is precisely what leads to active TB disease. Given this risk, it is incredibly important to know if you have latent TB, especially if you belong to a high-risk group or have been exposed to someone with active TB. If you are diagnosed with latent TB, your doctor will likely recommend a course of preventive treatment. This treatment is designed to kill the dormant tuberculosis bacteria before they ever have a chance to become active. By taking this proactive step, you can significantly reduce your risk of developing the more serious active form of the disease. It is a vital strategy for both personal health and public health. Without appropriate preventive treatment, roughly 5 to 10% of individuals with latent TB will eventually develop active disease at some point in their lives. For people with severely weakened immune systems, like those with untreated HIV, this risk is substantially higher, potentially reaching 7 to 10% per year after infection. It is also fascinating to note that the highest risk period for activation often occurs within the first 2 years after the initial infection, although it can happen much later too. This knowledge underscores the critical importance of early detection and intervention for latent infection. Understanding the distinct difference between latent infection and active disease, and recognizing the very real potential for reactivation, truly empowers you to take proactive steps for your own well-being. By identifying and treating latent TB when it is still dormant, you are not only protecting yourself from the challenges of developing active disease, but you are also playing a crucial role in preventing its potential spread to others in your community. It is all about staying informed and taking decisive action against a very resilient bacteria.